Did you know that because babies aren't breastfed, 1.5 million children die each year? Did you know that $13 billion are spent each year in the U.S. on sicknesses that would have been prevented by breastfeeding? Pediatricians recommend that all babies be breastfed for at least 6 months. But in the U.S., less than 15% are breastfed for that long. What is going wrong? Why don't more mothers breastfeed?
Globally, less than 40% of infants under 6 months of age are exclusively breastfed. And if children were exclusively breastfed, millions of children could be saved. So the World Health Organization recommends that infants be breastfed exclusively for at least 6 months, and if possible, for a year or more. And bottle feeding of any kind should be avoided. And the World Health Organization also recommends that mothers who are breastfeeding have at least 16 weeks of leave so that they can breastfeed their babies at least 6 months. Many women, because they have to go back to work, actually stop breastfeeding before the 6 months of life. It's important that women have time and a clean and safe and private place to breastfeed their children. It would be ideal if on-site daycare were available for women who are breastfeeding. Breast milk is the ideal food for infants. It has all the antibodies that they need to protect them in the first months of life, especially from diarrhea and respiratory diseases. It also helps them to define and to understand and to control the amount of food that they intake, which is very important. As we know later on in life, people who can't control or don't know how to manage the amount of food they consume can then lead to obesity.
I just don't understand why more mothers don't breastfeed.
I think many women have to return to work soon after having their baby. They just don't see how they can continue breastfeeding and returning to work. It is hard. I did it for 5 months and I had to quit. Most moms don't even start, especially if they work in a store or in food service.
I was very apprehensive about returning back to work. So when I returned back to work, I was very happy to see that my employer provided the space, and they also provided the time for me. I was able to take breaks during my work day, and I was also very happy that they provided the privacy for me to be able to pump breast milk for my 2 babies.
If you weren't here, where would you pump your milk?
That's a good question. I'd hope not the bathroom.
Yeah, that's disgusting.
There's an office in the back that you can use that locks.
It's very hard coming back to work after your first child, and it doesn't get any easier after the second one. But I wanted to be a good mom, and it was very important that I was able to come to work and pump my breast milk for my babies, knowing that I was providing the best nutrition for them. The relationship with my employer improved greatly. It just opened up those lines of communication, and it made the relationship closer between me and my employer. My employer was the one that provided the space and the time and the privacy for me to pump my milk for my children, and it just motivates me more to be a productive employee, knowing that I'm being a good mom, so it helps boost my morale.
I think breastfeeding is important for a number of reasons. Obviously, first and foremost, the baby. We know that breast milk is by far the best food for a child that has exactly the right combination of proteins and hormones and carbohydrates and sugars. So it's much easier to digest, and that probably in large part explains why they have lower rates of diabetes, they have lower rates of obesity, they have lower rates of leukemia. In fact, we've even discovered that there are lower rates of SIDS, or sudden infant death syndrome, in children who are breastfed. In addition to the actual physiologic benefits of having breast milk, I think children undoubtedly are happier, closer to their mother, feeling the warmth and that they felt their entire time in the womb, hearing that heartbeat, hearing voice, etc. For mom, similar types of benefits. Mothers who breastfeed always have milk ready. It's always at the right temperature. It's always sterile. It goes everywhere with them, and it's always in the right supply. You can save up to $1,500 a year in this country just breastfeeding. People are happier, babies are healthier, employers are more productive. Across the board, it is I think, a win-win situation. Now, I would hasten to emphasize, thank God we live in 2011 when the formulas that are available out there are very good formulas. And There are, unfortunately, some people who, either because of life circumstances or rarely because of physical attributes, are unable to breastfeed. In that case, if they don't use borrowed milk, and there are breast milk banks available across the country, thank God they have formula, and the formula is as good as it is these days, but nobody would say in a head-to-head contest that you're better off with formula than you are with breast milk.
Thanks, Dr. Powers. You've really helped us understand the importance of breastfeeding. Now, why don't we go ask some mothers what they think?
Spending good quality time with my husband outdoors, at social events, movies, dinner, that's what would make me happy.
Having a clean house when you get home, that would be nice. And having to do chores for a day.
Bathing my baby, as well as breastfeeding my baby. I'm just so grateful that my employer has a breast pumping room available to the employees so that we are able to breast pump and provide food for our babies even though we're at work.
Breastfeeding is the best way to promote health for mothers and babies. The benefits have been documented by the American Academy of Pediatrics. By becoming more friendly, a business saves money through improved staff morale, increased productivity, reduced staff turnover, and reduced absenteeism due to sick child. The recently passed Patient Protection and Affordable Care Act of March 23, 2010 includes Section 4207, a provision for workplace breastfeeding support. The legal provision requires that employers provide reasonable, unpaid break time and a private non-bathroom place for an employee to express breast milk for her nursing child for 1 year after the child's birth.
I also spoke with Mrs. Amaya, director of the WIC program. Here's what she had to say.
As a manager, it's very important to have a mother-friendly worksite initiative established. We need to look at policies as they relate to providing them at least 2 15-minute breaks, one in the morning, one in the afternoon, as well as 1 hour lunch. And what we're trying to do with this is to make sure that we support the employees continuing their breastfeeding initiatives while they're away from their baby.
All the experts agree that breastfeeding is important. So now you know.